It's 35 years since I started my nurse training here, and the site of the museum is what used to be Ashley Wing, so care of the elderly. One of the biggest challenges I think that we have across the NHS is workforce, so being able to get people that want to come in and have careers in the NHS. We don't have enough doctors, we don't have enough nurses, so we're increasingly looking at different ways that we can make those careers attractive, and also to think about different roles that we can develop. So how pharmacists, for example, can work within general practice, how paramedics might have a role within general practice, mental health workers working alongside GPs.
I am hopeful that it will survive the next 70 years and our children will have the best services. The challenges are we don't have enough doctors, we don't have enough nurses, and we don't have enough money to embrace new technologies, new treatments. We need our patients and our people and our children to be educated how to look after their health. We need to put more emphasis on prevention of disease rather than treating it.
The NHS workforce is in crisis at the moment, so if we are going to secure the future, we have to resolve these issues. One of the great changes would be to see the NHS less buffeted by all the political parties as a hot potato they can kick around. In actual fact, it's too important, it's too precious for that, and we ought to come to a considered view as to how the NHS should be run, ensure the resource goes into it so that patients can be looked after at the point of need, and that research findings can be quickly implemented for the benefit of patient care.
Over 3/4 of the NHS workforce are women, but when you look at very senior positions, so we're getting small in number, less than half, are occupied by women. And then when you look at representation of people from black and minority ethnic groups, it's even smaller again. So there's a lot more that we need to do in order to get that better balance in the most senior positions and recognise that that'll have a positive impact. The bigger we can have a change on the experiences of staff working in the organisation and the service that we provide to local citizens.
The single thing that would make the biggest difference is to recognise that the original NHS constitution talks about people's responsibilities, and I think to protect the NHS for the next 70 years, we as people, patients, carers, have a responsibility to live our lives in a way that supports the NHS, to look after our families, to eat, drink, smoke less, to exercise a little bit more, because that's the thing that will end up protecting the NHS for the next 70 years.
Well, we asked the government for a response to what our professionals said at the Thackray Museum, and we had this earlier from Health Minister Lord O'Shaughnessy.
Yes, well, we know the NHS needs more money, and it needs more money for two reasons, really. First of all, our population is growing, there's more of us, and we're getting older. And obviously, as we get older, that means we have more care needs. So that is the background to the Prime Minister announcing, which I think is going to be welcomed by everybody, that in 5 years' time, the NHS will be spending £20 billion a year more in real terms. So that's about 3.4% on average over the next 5 years. We've actually just agreed a big funding increase for extra pay for nurses. And we're looking at ways to make the job more flexible and more attractive.